Cardiomyopathies. Cardiomyopathies. What are cardiomyopathies? What are cardiomyopathies? Welcome to the live chat. Welcome to the talk. And we had started management. And it's important we revisit some topics. So as we come in, as we talk and register to whatever that we are going through, as we register on whatever that we are going through, our topics, our lives, everything that we are doing, we know our target. Our target is everyone to be healthy, everyone to be okay, and everyone to have a happy. Let me drop to anchor a bit. Okay. See a message from Jamaican uncle. When you receive it, you have to call back, because when the elders are calling, it's important you call and find out what is on. So today we are dealing with cardiomyopathies. Today we are dealing with cardiomyopathies. What are cardiomyopathies? These are diseases of these are group of diseases that are affecting the heart muscle, and a group of diseases that are affecting the heart muscles. Those are called cardiomyopathies. When the heart has got so many problems that even one single mistake can make you to lose the normal circulation of your body. So you see, we started by valvular diseases. We went to several things that are affecting the heart, the muscles themselves, the arteries themselves. You see, so many things. But now we have come to a particular thing which is called cardiomyopathies. And we will go step by step to know what are cardiomyopathies. Cardiomyopathies, welcome Jamaican uncle in the house. Yes, cardiomyopathies are a group of diseases that primarily affect the heart muscles, leading to structural and functional abnormalities. These conditions impair the heart ability to pump blood effectively and may result in heart failure, arrhythmias, thromboembolism, and sudden cardiac death. Heart muscles can lead you to have abnormalities like those ones. Heart failure, arrhythmias, and thromboembolism. So definition of cardiomyopathy is heart muscles complication that are caused by coronary artery disease, hypertension, valvular disease, or congenital heart defects. See, or congenital heart defects. So let me see here. We have several types of cardiomyopathies, and first of all, we have dilated cardiomyopathy. Dilated cardiomyopathy, and then we have another one which is hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, and then we have another one which is restrictive cardiomyopathy. Restrictive cardiomyopathy. Restrictive cardiomyopathy. So these are the problems that we want to know, and we want to understand one by one. We want to understand one by one what is the problem, because we are saying cardiomyopathies are problems that affects the heart muscles, leading to some other complication. But we have three types. So when we have three types, what is the problem? Heart muscles are heart muscles. So let's review the three, but starting from the top. Classification of cardiomyopathy, dilated cardiomyopathy. Dilated cardiomyopathy is characterized by the enlargement of the ventricles. Smile in the city is in the house. Welcome. Of the ventricles and impaired systolic function, resulting in reduced cardiac output. So there are some causes. You see, these ventricles of the heart, the ventricles of the heart. Let's see the ventricles of the heart. These are the ventricles of the heart. So when they are bigger than the normal, let's take this as the normal ventricle. So when they are bigger than this, maybe this ventricle is coming up to somewhere here. It has dilated up to somewhere here. It means the blood that is coming in these ventricles is not enough. When it is pumped, it is less. The ventricle is so thick that it is pumping less blood in the system. And we don't want that. We want blood to come as it is and go to a good ratio. You remember when we're talking about ratios that the blood can pump? That is what we want. But now your ventricle is dilated, it is big. So pumping blood becomes a problem. You see, the atrium becomes a problem when the atrium is bigger, the muscle here is bigger. Because if it is bigger, it means what? Less blood is being pumped, less power is there. So dilated cardiomyopathy, it is dilated. It is bigger. There are some causes that can cause dilated cardiomyopathy, like genetic mutation. Marjay, hello, Marjay B is in the house. Marjay B, welcome so much to the house. It's a topic of that I forgot, but today we are dealing with one by one. I'll deal with dilated cardiomyopathy, and then we'll see if time is there, we can deal with restrictive cardiomyopathy. So there are some causes that are there. If you're coming in right now, please like the video. Let's see how things change and roll as we go. We continue. Now, let's talk about dilated cardiomyopathy. What causes? There are some genetic mutations. We talked about mutations when we are conceiving. And we By the way, before we continue, we had a topic yesterday at night, the request of some of us about those people that use family planning. Thanks a lot, Boss One, for watching from TV. Thanks a lot for that. Those people that uses family planning, and then they don't conceive again a baby. We talked about. Let me go that faster. The family planning pills, what they do, they stop the hormones that are supposed to be helping you to receive babies. This is a short, simple term. You can review the you can review the video. When it stops those hormones, you become generally acutely infertile. Please go watch those videos so that you can see what we discussed. Now let's continue with the causes of dilated cardiomyopathy. Genetic mutation, viral infections. Mostly there is a virus called Coxsackie B virus. Chronic alcohol use. You've seen so many people that are alcoholics. They are struggling with heart conditions. Peri, peripartum cardiomyopathy. After, before you get what? You get a baby. Antepartum. Stan's kitchen is in the house. Stan, welcome to the house. Welcome to the house. If you have a question, any medical question today, I'll not take long. I will take like 30 minutes to introduce this, the first one, and then we can see the other one next time. Peripartum cardiomyopathy is a life-threatening heart failure. It occurs in pregnancy. If you're coming in right now, please, a like is a good thing. Please give me a like. Let's interact as we continue. In last month of pregnancy, those people that are pregnant more commonly within the first months, most commonly within the first month. So if it is common in the pregnancy, you see, you are dealing with a mother who has a baby inside, and it can give a problem. So that is, you can get peripartum if you are. Greetings, doctor, and all. Welcome. You can get peripartum cardiomyopathy when you are pregnant. Nutritional deficiency like thiamine, and it causes beriberi diseases. Those people that have gum problems and bleeding, you can get dilated cardiomyopathy because when you don't have thiamine, the heart muscles they enlarge, and when they enlarge, it starts bringing problems. Autoimmune diseases like arthritis can do that. HIV infection, because HIV, it is reduced immunity. So when you have a reduced immunity and you have HIV, you really need to see a CCC. You go to get the drugs and you continue with your therapy so that you don't receive immune deficiency. Idiopathic. Idiopathic, it means some causes are not known. You are just born with a big heart. But one asked about big hearts. Now you shall know big hearts can bring dilated cardiomyopathy because when this one is swollen, no blood is going enough to the body. It is taking part the area that is supposed to be filling blood. So pathophysiology, how does it occur? How does this thing occur? How does cardiomyopathy occur in some people? Now it occurs like this. Dilation leads to reduced contractility. So you see, when it is bigger, the contraction power reduces. The contraction power reduces. So it reduces ejection fraction that we talked about to less than 40%, because all the blood that comes in the left ventricle should go more than 40%. You get it? Compensatory mechanism activation of renin, angiotensin, and aldosterone, and you if you are here and you have not watched the video on renin angiotensin, what the kidney does, please go and watch it. It is so refreshing. So that is compensation mechanism. Renin activates a system whereby the veins constrict. And you know, when your veins and arteries constrict, what happens? You get high blood pressure. So this is how dilated cardiomyopathy starts these things. And then sympathetic nervous system, which is once in cardiac remodeling. What will you find to these people that have this problem, that have the ventricles that are dilated? This is what you will find: dyspnea and fatigue. They are always tired. Tired. Why? Because the blood that is being pumped in the system is low. So you cannot do what? You cannot have enough oxygen that enhances metabolism in your system. You check it. It's very important. When you see a person is always this person is always tired, I advise this person to be checked the heart. We have another one called orthopnea and paroxysmal nocturnal dyspnea. At night, you are always losing breath, and you're not getting breath as you're working. Very important. Check out what I've told you. Check the heart. Peripheral edema. Sometimes your legs are swelling. If you check the person's hand is swelling, palpitations, signs of heart failure comes on. You get S3, gallop, and cardiomyopathy. Yesterday, I talked about the sounds of the heart, and I said there are two sounds, S1 and S2. Dap. And then we have lap, dap, lap, dap. But when you hear the third one, dap, the third one, no, it is having a problem. The dilated cardiomyopathy is giving a problem. Greetings, Dr. Kingray. Thanks. Welcome. Today I'm just having a social session because I'm running to. I have a patient that I want to see, and it will take time. So, you've understood about dilated cardiomyopathy, the causes. These are problems that are brought by the heart muscles dilating and becoming bigger. Sorry, and becoming bigger. Now let's introduce the other one, the third one. I'll deal with management when I've introduced this topic because it's the last topic on heart. We have dealt with some of the things about the heart. So tomorrow we are starting diagnosis, how to know these problems, how an ECG works. That is what we are starting. So I didn't want to leave this topic behind. Hypertrophic cardiomyopathy, Hypertrophic cardiomyopathy is characterized by abnormal thickening of myocardium, especially the intraventricular septum. This one is called the intraventricular septum. This one. So this one, without an obvious cause such as hypertension, is just thickening, only thickening. That is called hypertrophic cardiomyopathy. Autosomal dominant mutation in sarcomeres protein. Inside this, there are some proteins that they start becoming heavy. So what happens to this? What brings this hypertrophy? What is the danger the people with arthritis on the legs can face? For example, the ankle. Stan's Kitchen, before I continue here, when you have arthritis, the first thing you can face is severe pain. If you are coming in right now, please like the video, my guys. Like the video as we continue. Today I've said it will be that short session. Pain, you can have pain. Arthritis can get into your organs like the kidney. Innervation becomes a problem. Arthritis can get into you can have difficulty in walking. You can have difficulty in touching holding a cup, even where the normal general things that you are supposed to do. And then it can get into your brain. You have a condition called dystonia. There are so many things that can happen when you are having these problems, Stan's Kitchen. So you need to visit a doctor for management. You need to visit a doctor for management. Arthritis. We have talked about arthritis so long, and it is in the check on the playlist. You will find a topic on arthritis, and you will appreciate. You will appreciate. In relation to the heart is innervated by vagus nerve, which is the cranial nerve 10. So if arthritis interferes with the vagus nerve or the vertebral nerves, nerve 1, 2, 3, and 5, the heart will not be innervated. You will have a problem when you are pumping blood. So you may have sometimes fainting, sometimes dizziness, you get, or sometimes the opposite. If arthritis gets to your vertebral bones for sympathetic nervous system, you can have tachycardia, heart beating so fast. So check on them. We will talk about arthritis. Don't worry, Stan's Kitchen. We'll talk about it. Even if we did it again, we'll talk about it. Okay, let's continue in hypertrophic cardiomyopathy. You see, hypertrophic, we have said most of it affects the septum. This one, the septum. A clinical septal hypertrophy obstructs the left ventricular flow. So when this one is swollen, it affects the flow of blood to the outer. Because when it is swelling, it closes here. And you see, this is the road. The veins are here. It is the road to the body, to the system. Oh, okay. It's okay, Stan's Kitchen. You can share these topics to your friend. At least just share. Your friend will go to the playlist and he will find these topics there, and he will appreciate. Or introduce your friend to this channel. Let your friend come. Akansha Genzi. Hello, Doc. Akansha this side. Oh, welcome, Akansha. Today we are having a short topic on cardiomyopathies, dilated and dilated cardiomyopathy, and restrictive cardiomyopathy, and the third one. Welcome, Barbara World. Greetings. Welcome to the topic. Now, we have said, how does it come? How does this hypertrophic cardiomyopathy come? Asymmetric septal flow impairs the relaxation, leading to diastolic dysfunction. It gives risk of arrhythmia and sudden cardiac death, because if blood is not flowing as it's needed, what will happen? Oxygen will not be there. So if you don't have oxygen, you will get sudden death. Clinical features will get like exertional dyspnea, chest pain. Gabriel, welcome to the chat. I'm having hiccups. Don't worry, they'll just go away. I know what I did. Chest pain, syncope and pre-syncope, palpitations. Sudden cardiac death in young athletes, because most of them, the septum is dilated. Most of them, the septum is dilated and it obstructs blood. So it needs surgery at a point. So a person with dilated cardiomyopathy, you will find exertional dyspnea, chest pain, syncope or perisyncope, or palpitations, the heart beating so fast, the heart beating so fast until at times you check on your clothes and then it is vibrating. Those one is dilated cardiomyopathy. You get. Now, investigations that we'll deal with them later. The last one is restrictive cardiomyopathy. Restrictive cardiomyopathy is characterized by stiff ventricular walls leading to impaired ventricular filling and diastolic dysfunction. It causes some problems that are called amyloidosis. A certain protein, you know, even the protein of your body. Yes, Barbara's World, welcome, welcome. Thanks a lot for your greetings. The proteins of your body at times they mutate, so they start doing things that they are not supposed to be doing. The protein. So when these proteins come to the heart vessels, what they do, they start doing what? The ventricular wall are impaired. So they stop doing the work of pumping the blood. You get it? They start becoming stiff. Hmm? Because of amyloidosis, sarcoidosis is still the protein hemochromatosis, endomyocarditis, myocardial fibrosis. Fibrosis is when it's injured, and then when it's injured, you get it cannot contract and relax. It cannot contract and relax. You see, pathophysiology, reduced ventricular compliance. They cannot push blood. They cannot push blood. Normal or near normal systolic function. Elevated filling pressure leads to atrial enlargement. Atrial enlargement becomes so large, sometimes even you get hypotension. So always you'll find these people with fatigue and dyspnea, peripheral edema and ascites. Ascites, I said, is the having fluid in the pericardial layers of your peritoneal layers of your stomach. Elevated jugular venous pressure, hepatomegaly, and Kussmaul breathing. And then we have another condition that is so fun. It is called arrhythmogenic right ventricular cardiomyopathy. What is arrhythmomatic? It's a genetic disorder in which the right ventricular myocardium is replaced by fatty tissue. You are born by, but the right ventricle, instead of the muscle, it is fatty tissue. So pumping blood, when you have fatty tissues, pumping blood becomes a problem. Pumping blood becomes a problem. Mutation is this muscle protein. You will get palpitations, syncope, ventricular tachycardia, sudden death in young adults. Such big name. No, they are not big name. Listen, Akanesha, arrhythmogenic right ventricular cardiomyopathy. It means arrhythmogenic. The rhythm means rhythm that is not okay. So it is producing a rhythm that is not okay in the right ventricular cardiomyopathy. Cardiomyopathy means diseases of the heart. Only that. So this one is a genetic problem, and it needs surgery and replacement of some specific things here. So today we are not doing a lot. I had to introduce that before I go to work. Today maybe I'll come at 10 to continue with some things, but I have, it is already 5:30 minutes now. Anyone with a question? Anyone with a question? Anyone with a question? Before I come? Before I come, anyone with a question, please type your question as I come to clear. Oh, what causes hiccups? I have hiccups right now because yesterday I got some drugs and giving me some hiccups. Drugs can give you hiccups, and the pressure. If you take some foods, can give you hiccups. Oh, okay, okay. Thanks, Akanesha. On those, watch the other one. They can help. They can help about all. They can help. And if you have a question, you can ask about it, even if it is private. So let's see. Let's see. I was Margaret. Oh, Maggie. Today you came as I was like going away. I have to go and deal with someone. So I was answering Margie. Drugs can give hiccups. Drugs can give hiccups, and food can give hiccups. Food, especially when you are using a lot of pepper, especially when you are using a lot of pepper, you can get hiccups. And oh, Margaret, today you had a busy day. Sorry about that. Yes, if you eat your meal so fast, you can get hiccups too. Hiccups are brought by acidity, imbalanced pressure, or anxiety of the diaphragm, the phrenic nerve. So those are things that can give. I think Majay has realized I have hiccups. That's why he has asked that question. But they'll go away. They'll go away. So anyone with any question? Someone is missing that person. So someone is missing me. Akansha is saying someone is missing me. Yes, I had that even in our culture. I had that even in our culture. Pepper gives uncle true. Pepper gives it so much. So ladies that are in the house and even men. Yesterday I did a video so late in the night, and it is a very important video. Please, if you have not liked, please like the video. Like the video. As we finish today, we had no big topic. I'm preparing on a topic on how to manage these problems and diagnosis. Today, I have 10 minutes to go. And I would really like uh, those that have not watched the night video, please go. It is a helping to our mothers and ladies, because most of the mothers use family planning, and this family planning are the problems of the day. This family planning are the problems of the day. So check that video on family planning. As you use the hormonal method, you know what the problem is. You get it? When some problems come, you know how to deal with them. Hmm? It it is a very yes, Suzanne asked the question yesterday. Yes, Suzanne asked, and I did it at night. I know some people have not watched it. Some people have not watched it. So any question that I can deal with, I have 10 minutes before I leave. Any question, guys? I think I've dealt with arthritis. We will do arthritis after we will do autoimmune diseases after heart conditions. After that, helping in diagnosis and treatment of all the heart conditions that we them, we will deal with autoimmune diseases like lupus, osteogenic imperfecta. All those we will deal with them. So I think we have no question. Thanks everyone that has tuned in. We love you, and I'll come back at 10 to introduce the. Please be there at 10. Yes. Please be there at 10 as we do what? As we introduce the topic on how to diagnose heart project problems, and I will introduce the how an ECG is done, because it is part of the diagnosis of heart problems. So we will deal with how an ECG is done. So be there, guys, and hello, Mike Kilia is here. As we finish, Mike, today I have so many things to do. Yes, we'll see you there. Please, it is 5 now in Kenya. So at 10 is 5, 6, 7, 8, 9, 10. After 6 hours, that will be after 6 hours. In which country are you, doctor? Which time zone? East African time. Stan's kitchen. Which country are you at? I see what time it will be. Yes, 10 per Kenyan time. Akanesha, what time are you in right now? This is Kenyan time, 10. Yes, yes, 4 to 5 hours ahead. So here is 7:40. AM or PM? Thank you, Stan's Kitchen. Thank you for everyone who has tuned in. Please, I leave you. If those will make it to be in that chat, you can watch. But the ladies that are in the house, please go and watch what we did yesterday. Thank you so much for tuning in. Let's meet again that time. Bye. See you guys.